Hello, Jennifer. Welcome to the clinic today.
Thank you.
So you're ready to have your lips done for the first time, huh?
Yes.
And I see you've never had any cosmetic procedure done.
No.
Well, we'll make it very easy for you today, okay?
Okay.
All right, let's take a look at things here. Go ahead and hold the mirror up there. So what are you thinking with your lips?
Some more fullness up on the top especially, but all around just some more fullness.
Okay, so let me show you what I think is going to look best with your specific case here. I agree. I think that we're lacking a little bit of fullness. We have more room to go on the upper lip. So we'll take this up about maybe 25% on both the left upper lip and the right upper lip. And then we'll put a nice border all the way around the lips. And then I like to bring the lower lip out a little bit, flip it out right in the center. That's a real nice look as well. It's difficult for you to visualize it at this point, that we're going to do this together very slowly. So that's the nice part about it. You kind of see what you get as you're getting it. So we'll not go too fast. We won't add more than you want. I think that's one of the things that most people are afraid of, that we're going to make their lips too big or they're going to walk out of here looking freaky. But we'll do it together and we'll go very slow so we can get it right on exactly the volume that you want.
Okay, so we'll be able to see the results immediately then?
Yep, you'll see them immediately. You'll have a good insight in the first 20 or 30 minutes. Then some swelling sets in. The swelling is minor, but it does distort things. So you're going to expect to have about 24 to 48 hours with your lips being a little swollen, where if this is your first time doing it, you want to just plan accordingly where you don't have any events or anything to go to.
Okay.
As far as longevity with your new lips, we are going to use hyaluronic acid today, either Juvederm or Restylane, which are kind of the gold standards in the United States for filling in lips, lines, and wrinkles. And when you talk about these fillers, one of the most important common questions that I get asked from my clients is, how long is it going to last me? Because they hear all kinds of different things from the companies that advertise. Maybe their friend had it. Well, I'm going to tell you, from thousands of injections over the past 8 years, I've probably done 3,000 lip injections over the past 8 years. There's some days where we'll do 8 to 10 of them on people. So we certainly speak from a lot of experience and not just reading what the companies want you to believe. But here's the kind of the breakdown of the way that I see with my patients from real experience, that the first time they do their lips, they're going to be happy with it for about an average of 5 months. They may be happy for 3 months, they may be happy for 8, but I see about 5 months for the very first time, because it's the first time that their lips are exposed to the substance. Mm-hmm. So we're building. It's kind of a building process. And that, at about 5 months, it's going to be down about 50%. And then we hit it again. The second time, it's going to last a little longer. It's about the third time that we do the lips, what I call the slam dunk period, that the lips are going to last a good 6 to 12 months. Some people even longer. So my patients that I've been seeing for 7 or 8 years, I might only see those patients for a reboost once a year. Mm-hmm. So at that point, after you've had it done several times, it becomes pretty cost effective to keep your lips where you want to keep them.
Right. All right, great.
All right, so we're going to start the process with doing a nerve block, just a simple dental block,
okay,
with a little Novocaine, no epinephrine, so your heart won't start racing on you or anything like that.
Okay.
Just a minimal amount of Novocaine to numb the upper and lower lip, because comfort is very key with this. Your lips are one of the most sensitive parts of your body, and we want to keep it as comfortable as possible.
Okay.
Okay, so we'll block the mouth up here. Pretty good with nerve blocks, so you're not going to feel much. Not too bad, was it?
Not at all.
Good. Alright, the hard part's over with. Now you're going to get nice and numb over the next few minutes, and then we'll start filling it in.
Okay.
Alright, so we're going to start filling the edge of the lips up. I'm going to go around and fill the border in that we talked about. So just relax. But you're pretty numb. You're not feeling that much at all, are you?
Mm-mm. Not at all.
All right. Very good. Almost done filling the border, just the last little corner here. And then we'll fill in a little bit, the last little bit on some volume here. What we've done is really thicken up the edges, and it's not anything bodacious or over the top, so no one will know in the next few days that you actually had your lips done. But I think people will comment that you have very beautiful lips. And then in the future, what we can do is we can just add more and more. Like I said, the first step in building lips for someone is giving you that initial insight into what you're going to look like, because I think everybody wonders, what am I going to look like when I have my new lips? Then from this point, you can guide me, and we do it together. In the future session, say, Dr. Hall, I'd like it done a little bit more or a little bit less than previous. And so it becomes a very interactive process, very patient-friendly. All right?
Looks great. Thank you so much.
You're welcome. We'll get a little ice on it, and we'll get you out of here.
Okay.